Today is Tuesday, September 30th, and I'm Zach Caruso. Our lead story this week is from the American College of Obstetricians and Gynecologists and is titled Cannabis Use During Pregnancy and Lactation. Cannabis is the most commonly used illicit drug under U.S. federal law. With increasing social acceptability, accessibility, and legalization in many states, the prevalence of cannabis use among pregnant and lactating individuals has increased significantly. Substance use in pregnancy, including cannabis use, has been associated with adverse outcomes such as spontaneous preterm birth, low birth weight, and developmental delay. Clinicians should be aware of the possibility of pregnant and lactating patients' use of cannabis and be prepared to counsel and screen all patients and use evidence-based strategies to reduce cannabis use. These include supportive home visits, psychobehavioral strategies, or brief electronic or text messaging interventions to reduce cannabis use in pregnancy and the postpartum period to promote parental and newborn health. Next is an article in JAMA Psychiatry titled Parental Diseases of Despair and Suicidal Events in Their Children. The adolescent suicide rate has increased 60% between 2007 and 2020. This study used insurance claims data to look for a relationship between suicidal events, or SE, in children 8 to 15 years old and deaths of despair, or DOD, including suicide, drug overdose, or alcohol-related diseases in their parents. They included 561,000 families with parental DOD between 2011 and 2020. Having a parent with DOD was associated with an increased risk of SE in the children. Exposure to two parents with DOD was associated with a greater risk of SE in children than exposure to one parent with DOD. In younger children, age 8 to 11 years, this association was greater for girls than boys. There was a stronger association for maternal DOD than paternal DOD. Authors conclude that the epidemic of DOD in adults and the epidemic of suicidal behavior in children are associated. Next is a study in JAMA Pediatrics titled Cost Effectiveness of Treatment for Opioid Use Disorder in Pregnancy and Its Impact on Birth Outcomes. This is a cost-effectiveness, population-based analysis of a simulated cohort of 100,000 pregnant patients looking at the clinical progression and outcomes of OUD treatment during pregnancy. The main outcomes were return to illicit use, fatal and non-fatal overdose, incremental discounted costs, quality-adjusted life years, net health benefits, infant mortality within the first year of life, preterm birth, low birth weight, and NOWs. Both methadone and buprenorphine were viable options for treatment. However, in the model, buprenorphine showed an incremental effect of 0.262 quality-adjusted life years per person and mean cost savings of $21,512 per person. Our next article is in the Journal of Social Work Practices in the Addictions and is titled The Benefits and Potential Biases of Lived Experience in Substance Use Treatment Services. Researchers conducted qualitative research interviewing both patients and providers to evaluate potential benefits and downsides. Patients identified feeling less alone and having models of successful treatment as potential benefits. Both patients and providers identified developing better rapport and connection as benefits, while providers also noted it helped them communicate with their colleagues the importance of compassion for this population. Providers noted potential bias if they compared patient progress or treatment pathway to their own journey, but this can be mitigated with treatment. Authors suggest these findings support the need to assist persons with lived experience entering careers such as counseling, nursing, and addiction medicine. Next is a study in PLOS Global Public Health titled Alcohol-Induced Deaths in the United States Across Age, Race, Gender, Geography, and the COVID-19 Pandemic. This study analyzed alcohol-induced deaths by race, gender, age, and geography on a yearly and monthly basis using data from the National Vital Statistics System. Crude rates for alcohol-induced deaths increased by 89% from 1999 to 2024. The largest relative increase occurred among females aged 25 to 34 with a 255% increase, and males aged 25 to 34 with a 188% increase. American Indian and Alaska Native populations remain the most affected. While alcohol-induced deaths are higher among males, crude rates are rising faster among females across all demographics, a concerning trend. The largest monthly increases in alcohol-induced deaths occurred in American Indian and Alaska Native males and females, Black females, males aged 15 to 34, and females aged 35 to 44. In Oglala, Lakota County in South Dakota, McKinley County in New Mexico, and Apache County in Arizona, crude rates have exceeded an astonishing 80 fatalities per 100,000 annually since 2020. These findings emphasize the urgent need for targeted policies to reduce excessive alcohol consumption and improve access to treatment. Our next article is in the Journal of Gambling Studies and is titled Betting on the Future, a systematic review of modern gambling interventions for college students. This is a systematic review of RCTs aimed at reducing gambling behaviors among college students. 14 total studies met inclusion criteria. Cognitive behavioral therapy, or CBT, particularly group-based CBT, and motivational interviewing reduced gambling frequency and harm, whereas personalized normative feedback interventions significantly lowered perceived gambling norms and self-reported behaviors. Digital approaches, cultural adaptations, and interventions targeting online gambling are areas in need of future research. Next is an article in the Journal of Internal Medicine titled Neuroendocrinology Meets Addiction: Emerging Pharmacotherapies on the Horizon. Gut-brain hormones and stress-related hormones have been shown to be involved in reinforcing behaviors related to not just eating, but also alcohol and other substances. In this paper, authors review preclinical and clinical evidence for various neuroendocrine pharmacotherapies, including GLP-1R, ghrelin, growth hormone secretagogue receptors, glucocorticoid, and mineralocorticoid receptors. While there are limited clinical trials, preclinical trials have shown positive results across multiple substances, particularly for alcohol use disorder. The most research has been done with GLP-1A, including human studies. Authors note that while much additional research is needed, these pathways appear to be promising treatment approaches for alcohol and substance use disorders. Our final article is in the Substance Use and Addiction Journal and is titled Stacking the Risks: Fatal Consequences of Anabolic Steroid Misuse and Stacked Substance Use in FAERS Data. The stacking of anabolic androgenic steroids, or AAS, describes combining AAS with fat-burning agents, diuretics, growth hormones, thyroid hormone, insulin, estrogen receptor modulators, and CNS depressants. This study used the FDA Adverse Event Reporting System to identify 218 cases of adverse events from misuse of AAS among men. The events were serious in 47% of cases, including deaths. Serious outcomes were reported in 98% of cases involving stacking, compared to 26% in non-stacking cases. The most common adverse events were cardiovascular, endocrine, and psychological. High complexity stacking was more common in younger individuals, and death or life-threatening events were associated with younger age and number of drugs stacked. Authors call for public health education about the risks of AAS.